Good morning to one and all. I'm Dr. Tamanna from HIMT. Today, I'm going to discuss first aid of burns. Before we go into first aid treatment of burns, we have to have a basic knowledge or understanding of what are burns, how does it affect your body, what are the various causes and degrees of burns. So let's start with the definition of burns. Burns are a damage or injury to the skin and underneath structures. Underneath structures involves muscles, bones, and major tissues. So it is understood that burns might not only be restricted to the skin surface, it can also go beyond the skin and cause more harm. Next, we are going to discuss what are the various causes. How do burns occur? There are few examples given here. Burns can be caused by dry heat, extreme cold, that is frostbite and hypothermia, corrosive substances, friction, radiation, and sun's rays. The other classification is wet burns. The more better word would be to use scald, which is caused by wet heat from hot liquids and vapors. To make it more easy and simple to understand, we have divided into 6 types of burns. They are dry burn, scald, chemical burn, electrical burn, radiation, and cold injury. Now, what is dry burn? How do dry burns occur? We can give examples like whenever we touch any hot surface, okay, any hot metal surface, or while cooking, fire accidents, all these come under the term dry burn. Next one is scald, which is nothing but wet burn. Steam, hot oil, when you drink any hot coffee or tea, and if it accidentally spills on the skin surface, is also a burn. It might not be a major burn, but definitely it would come under first degree burn. Next one is chemical burn. We all know what could be the examples of chemical burn. It is acid and alkali. What is alkali burn? How do they occur? Common example we can use at home. We use bleaching powder, caustic soda, detergent powder, floor cleaners. All these are nothing but chemicals, but they will be classified as alkali. In my opinion, I think that alkali burn is more harmful than the acid burns because we will not immediately see all the symptoms of alkali burns. It might take some time. So once you realize the symptoms have started occurring like pain or color change on the skin, it means that it has penetrated beyond the skin and gone under tissues and muscles. In those cases, it is very difficult to do first aid also. So whenever we handle all these chemicals, it is always better to protect ourselves by using gloves. We can wear glasses so that no chemical is spilled on the eye. And always better to wear a mask. Next one is electrical burn. Electrical burns, in this we can give examples like low or a high voltage current. What is important in electrical burn is, unlike other burns, electrical burns typically it will involve only your heart muscle and the brain. Whereas in other burns you can see redness, pain will be there, blisters will be there. Whereas in electrical burn, most commonly what can happen is a person becoming unconscious. Next one is radiation burn. Examples of radiation, we can give sunburn due to ultraviolet rays, ultraviolet lamps, X-rays, all these come under radiation burn. The last type of burn is cold injury. Example for cold injury, we can give chill weather, drowning. All these are examples of cold burn. Symptoms would include frostbite, and when the temperature is very low, the result would be hypothermia. So these are the 6 types of burns. Assessing a burn. Now, what is the meaning of assessment? Assessment means to check, to evaluate. Whenever there is a casualty with burns, there are 3 important points to be checked. First one is extent of burn. What is the meaning of extent? Extent means surface area included. For example, if the chest region is involved, the area is quite large, so it would require immediate first aid. Also, we have something called as rule of 9, that is percentages of burns. So there is a formula to use that, and then we will start the patient by giving drips. So this is about extent of burn. Next one is depth of burn. As the name suggests, depth. Depth means whether it is only up to the skin or it has gone beyond the skin. In this only we have various classification of burns, that is first degree burn, second degree burn, and third degree burn. The last point is whether the airway is affected or not. Airway, we all know that it involves respiratory system. So again, we should know how lungs function, what is the normal pulse rate, what is the normal breathing rate. So all vital signs are very important whenever you come across any major burn. So this is about assessment of a burn. Next, we are going to learn the basic layers of the skin. How many layers of skin are there? There are 3 layers of skin. The first one is called epidermis. Epidermis is nothing but the outermost layer of the skin. Second one is dermis, which contains skin appendages. Vascular supply. Vascular supply means nothing but blood circulation, and nerve endings. Nerve endings which carries all signals and sensation. The last layer of the skin is subcutaneous tissue. Subcutaneous tissue can also be referred as hypodermis. So either you call it as subcutaneous tissue or you can also call it as hypodermis. So these are the 3 layers of skin. Once we know the 3 layers of skin, we can easily classify as first degree, second degree, and third degree burns. So this is a very common term which we call first degree, second degree, and third degree burns. It is always better to use a medical terms like superficial burns, partial thickness burn, and full thickness burn. What do you mean by superficial? Just the upper layer, that is epidermis is involved. Second one is partial thickness. So epidermis is completely involved, partially dermis is involved. So the term partial. Thickness indicates layers. The last one is full thickness burn, that is epidermis, dermis, and hypodermis. All the 3 layers of the skin are involved. So it is called full thickness burns. Now we are going to start with symptoms of first degree burn, and simultaneously we will also complete first aid for first degree burn. Likewise, second degree burn symptoms, first aid, and last one is full thickness burn and first aid along with it. Now, what are first degree burns? We have already discussed. What are the symptoms of first degree burn? Whenever there is any casualty, how would you define whether it is superficial burn or a partial thickness burn? So this all depends on symptoms. Symptoms are nothing but changes occurring on the skin. The most common symptom for a first degree burn would be redness, color change. So color will usually become red, the surface of the skin, because the skin is getting dehydrated and high temperature is there. It shows in the form of redness. It is one of the sign of inflammation. Second one is swelling. Swelling just means that the skin is slightly bulged. Third one is tenderness. Tenderness, we all know what is the meaning of tenderness. Skin becomes very soft. So there are chances that just the upper layer of the skin might peel off. This can usually happen in sunburn, heat stress cases. Now, what would be the first aid for first degree burn? If you see the picture here, just the first layer is affected, which is red in color because of high temperature. So first step or first aid will always be thorough cooling of the burn. Continuously, we have to pour water. If the casualty's arm is burnt, you can just ask the casualty to go under running tap water and cool the burns. What is very important is how long to cool the burn. Is it 30 minutes or 40 minutes or 20 minutes? Minimum of 10 minutes is very, very important. At least 10 minutes of thorough cooling should be done, not less than that. And we all know why we have to cool the burns, so that the skin is getting rehydrated, temperature is coming down, and faster recovery or healing will take place. Usually in first degree burns, the healing period or the recovery period will approximately take 7 days. Within 7 days, again, new skin cells will be formed and you won't even see any changes in the skin. It will be just normal. Next point, after redness, swelling. Even for swelling, when there is swelling, one important precautionary step, what we have to do is, near the burnt area, if there is any jewelry, for example, a person's hand is burnt. If he or she is wearing a ring, watches, bracelet, it is very important to remove before the swelling occurs. Why we have to remove all these jewelry? So that there is free circulation of blood. Once there is free circulation of blood to these places, more oxygen will be supplied and faster healing takes place. So this is the importance of swelling. Just precautionary step is important. Tenderness, we all know skin becomes very soft, so we have to handle that place very carefully. So other than cooling water, we can also apply ointment. What ointment can we apply? Silver sulfadiazine. Silver sulfadiazine is a chemical name. Always we have to remember the chemical name. Other than this, the company name would be like Bernol, Silver X, and many more are there. So we have to apply ointment. Why we have to apply ointment? To prevent from infection. One more important point in this is, whenever we apply ointment, always use a gauze piece. Never use cotton, because cotton will stick to the wound. So better we use a gauze piece, or any clean cotton cloth can be used to apply ointment. Sometimes even dressing can be done. Again, why dressing is important? To prevent infection. Whenever we give a dressing, remember the dressing has to be given at least 2 centimeters beyond the border of the burnt area, so that there is no infection. And always give a loose dressing. And when you give a dressing, we have to change the dressing at least 8 to 12 hours. That's very important. Don't keep the same dressing for a long time. This might itself lead to reinfection. So dressing can be done. So these 3 points are very important in regards to first aid. First one is cooling of burns by pouring water for at least 10 minutes. Second one is applying ointment. And third one is dressing. Precautionary steps would be like removing all the jewelry from nearby burnt area, so that there is more oxygen supply and faster healing can take place. If the stomach region is burnt, if the person is wearing any tight belt, we have to remove it. Similarly, in the legs, when feet are burnt, any tight shoes are there, we have to remove it. So this is about first degree burns. These are the symptoms and first aid. If any pain is there, we know that when we pour water itself, pain subsides. The person is not able to bear the pain, then we can give him painkillers. We can also see this picture where the larger area is there, but it is a first degree burn. In this, what would be the first step? Definitely pouring water. But if we pour water with more force, there are chances that skin can peel off. So the other method of cooling would be just take a wet cloth, place it over the chest. Continuously, you can do this for 10 minutes. Again, you can apply ointment. Since it is a large area, always take care of infection. There are 2 important complications in burns. First one is dehydration and second one is infection. So with this, we have completed first degree burns. Let's move to second degree burn, also termed as partial thickness burn. As you can see this slide, it is like a bubble, a boil sort of. We call this as blisters. Medical term, it is called blisters. Definitely, you will also have other symptoms like pain, swelling, color change. But this is very, very important. because in this second layer is involved where nerve endings are there, also blood supply is there. These blisters are usually filled with some fluid. This is nothing but our own body's fluid which is getting collected, and it helps in healing the wound. So whenever you come across any blisters, never ever puncture the blister. You can see this picture, 1, 2, 3, 4, 5, 6, more than 5, 6 blisters are there. If any casualty is there with this sort of burns, what first aid needs to be done? The first step, as usual, pour water for at least 10 minutes. Second step, apply ointment surrounding the blister. You cannot apply over the blister because it might burst and the fluid might ooze out. So never ever puncture a blister. Surrounding the blister, apply ointment, and if possible, give a loose dressing. Here we can see we have to remove all the jewelry before the blister and swelling appears. Now you can understand very clearly. Imagine there is a ring here. Over a period of time, what can happen? It might constrict that place. And because of this part of the finger will not receive any blood. When there is no blood circulation in the other end, we know what can happen. No oxygen supply. Slowly infection will take place. And there is also no movement of the fingers. So to prevent from infection, we have to remove all the ornaments from the nearby burnt area. And again, if pain is there, we can give a painkiller. Even in second degree burn, it might take 2 weeks to 3 months to heal, depending on where exactly the burn is. It's not like the first degree burn where the recovery rate is just 7 days. Here, it might take a bit longer, which is from 2 weeks to 3 months. Next, we will move on to third degree burn. You can see this picture, third degree burn. Completely all the layers are burnt. First layer, second layer, as well as third layer. So when all the 3 layers are burnt, skin can easily peel off. Underneath structures, major burns can be exposed. There is no, you can see here the blood supply is cut, nerve supply is cut. So when the nerve supply is cut, it means that pain is less. There is a rule which says that as the degree of burn increases, pain decreases. But what is very important in a third degree burn is you have to understand 2 important complications. First one, already I think I have mentioned, which is called dehydration. Loss of body fluids causing dehydration. If we don't correct it immediately, the next stage would be called shock. What is shock? Shock is nothing but it's again a medical term, which means that oxygen level reduces. There are chances that a person can become unconscious. When oxygen level is reduced to brain and heart, person becomes unconscious. It is very, again, difficult to treat an unconscious person. We don't want that stage to occur. So we are preventing it by correcting dehydration. Second important complication of burn is infection. The most common cause or death in case of third degree burns are these 2 complications. First one is dehydration, second one is infection. Now we will just see how to correct dehydration and infection. Any third degree burns, immediately start giving IV drips. Very, very important step. There is a formula called rule of 9. To give IV drips, approximately we have to check the casualties weight and percentages of burn. You can see this picture, which is clearly given. If the casualties front surface of head and neck is burnt, percentage would be 9%. Similarly, chest, 9%. Upper back, 9%. Likewise, leg, arms, all are 9%. Genital area is 1%. So depending on the percentage of burn, we will start giving drips. There is a formula here. And then we will continue giving drips according to the urine output. So urine output must be between 60 to 80 ml every hour. If such is the situation, continuously same amount of drips can be given. When the urine output is less, then we have to increase the drip. If the urine output is too much, we have to decrease the amount of drips to be given. Other than this, how to prevent infection? We have to start immediately by giving antibiotics. Very important. Also, TT injection should be taken in case of major burns to be on a safer side. And finally, we have to shift the person to a hospital. First aid is just correcting of dehydration by giving drips and preventing of infection by antibiotics in the form of injections. Other than this, we can just isolate the person. If any cloth which is sticking to the burnt area should not be removed, just leave it as such. When we shift the person, we have to shift the person to a burn care center where all the facilities are there. When we talk about the recovery or a healing phase, it is quite long. It might take from several months to years. Depending on the place where it is burnt, healing will take time. So only hospital treatment can be done. I hope in this small video, you would have understood what are burns, what are the various types and causes and classification. Thank you.